Hello, this is Debbie Bucher, RN and faculty with Parkland College, and this is for the LPN to RN Transitions course. And today we're going to be looking at Chapter 9 from the Laura Claywell text, which is communicating with patients and coworkers, which is very important. So communication is not only verbal, but it's nonverbal as well. And of course, communication is an interaction between two or more individuals with an exchange of information. So it's an expression from one individual or the sender, and it must be received by at least one other, which is the receiver. Verbal, of course, is spoken communication, and nonverbal, which is people's tone, pitch, their inflection, the intensity of how we speak, body behaviors, facial expressions, our personal and appearance and physical characteristics, as well as how we listen, use silence, use touch, and use space. Most of the communication between the sender and the receiver is actually nonverbal, when I'm sure that most of us think it's verbal, but actually most of it is indeed nonverbal. And so this nonverbal communication must be interpreted correctly by the receiver. Verbal and nonverbal communication must be congruent for a clear message to be presented and interpreted. So it's very, very important. And as far as verbal and nonverbal, verbal is actually only about 10% of our communication, where nonverbal is about 70 to 90% of our communication, believe it or not. And as a general rule, we are more aware of verbal messages than of nonverbal ones, but we really need to get better at that. When verbal communication agrees with nonverbal communication, the message sent is indeed clearer and more congruent. Therapeutic communication, and this is something that you'll be using every day, and you use it every day as you practice in your LPN practice, and you will continue to use it in your RN practice. It's very important, and it's when the nurse engages in a helping relationship with the patient and their family and/or caregivers. This requires us to have empathy, which is the ability to perceive the patient's needs and feelings, genuineness, ability to meet person to person in a therapeutic relationship. Positive regard is you imply respect and a willingness to work with the patient and communicate that the patient is worth caring about. Self-awareness is being cognizant of one's own feelings, as well as we want to be non-judgmental, and so we suspend our value judgments. Therapeutic communication does require empathy for an understanding of the patient's feelings, and they may have feelings of fear and helplessness. So therapeutic communication is very important. Hospitalizations are stressful, and the nurse must suspend value judgments and not take negative patient behavior personally. Statements to use for good communication are, tell me more about, I heard you say, you sound angry, sad, hurt, anxious. Can you tell me about it? Also, it must be hard for you to tell me how you're feeling. Sometimes when I feel sad, angry, anxious, hurt, etc., I find myself blank. Is that how you see yourself as well? So just some good communication that you can use with your patients. And some communication facilitators that aid with your communication and enhance effective communication. The use of warmth implies acceptance and friendliness, openness, empathy, and respect in all interactions. Communication needs to be provided for privacy, confidentiality, and comfort of the patient. And you must use appropriate humor and touch, as this can help foster a closer nurse-patient relationship. And always, always ask permission before touching a patient. These communication facilitators will help enhance effective communication. So important that you get a good grasp and sense of those. Active listening is also important. It's being attentive to the patient's verbal and nonverbal communication. Care must also be taken to consider culturally appropriate nonverbal behaviors. So you want to make sure that you understand this patient's ethnicity and what their health practices are. Your communication, you want it to be able to establish trust between you and your patient. This requires an open mind and full concentration to hear what the patient is saying. You need to verify and clarify messages. And again, you need to use open-ended questions like I told you about in the previous slide versus closed-ended questions. So this is one of the most important skills of an RN is active listening. Patients need to feel they are understood in order to feel connected to you as the nurse. Poor eye contact or chewing gum or having distracting movements during a conversation can communicate a lack of interest on your part. Instead, you need to listen intently, nod your head, use empathy, and acknowledge what the patient is saying. Effective and active listening requires the nurse to concentrate fully on what the patient is saying and to then clarify the message with using open-ended questions. Next are communication blockers. These tend to stop conversation and builds mistrust versus trust. It may be if you use condescending language, or you question a patient's reasons, or you just approach the patient with just being a task-oriented nurse. You refer to the patient as a room or bed number. You fail to listen attentively. You offer unsolicited advice or false reassurances. You use cliches and you engage in gossip. Any of those things will have a tendency to be a communication blocker. Patients hesitate to communicate with nurses who are condescending and abrupt. Patients should be able to reveal personal information to the nurse without being judged, and we never must judge a person. Don't be just a task-oriented nurse and refer to the patient as only as a room number or fail to listen attentively or offer the unsolicited advice. These are all things, again, that will not enhance communication. It would just make it worse and be hard to build a trusting relationship with the patient. Next is the nurse-patient relationship. The nurse-patient relationship is a planned and goal-directed process that focuses on the patient's feelings, problems, and needs. It is not a social or intimate relationship. There are different phases to the relationship. There is an introductory phase or orientation. It begins with the initiation of the nurse-patient relationship and starts the trusting relationship with the patient. It includes introductions and goal setting and orients the patient to the facility, unit, room, and healthcare team. So much of what you would be doing, say, like when a patient is newly admitted to your floor or to your facility. The nurse-patient relationship is a therapeutic relationship that is goal-oriented. And it's very important to let them know what your name is and also ask what their family and caregiver names are as well. Patients' concerns need to be respected and plan questions that are sensitive to the patient's beliefs and concerns. Next is the working phase, which is the longest phase of the nurse-patient relationship. Begins with a nursing assessment, interview, physical examination, and continues until the relationship is terminated. So you need to understand the patient's story, use opening and open-ended questions, positive interviewing techniques. You want to include the family and caregivers, and you also want to be already aware of the patient's current condition, altering assessments, interview, and exam as needed. Interactions are deliberately planned, implemented, and evaluated in concert with the patient to reach mutually agreed upon goals. Note questions that may have already been asked by others, such as a physician or another nurse, so you want to make sure that you review the documentation in the chart, particularly if it is on a new patient, because some of the questions may have already been asked even in that same day or within even the same few hours. So review the chart and other available information before beginning the conversation with the patient so that you do have an idea of what's going on with the patient prior to you entering the room. The RN needs to understand and engage in the patient's story and plan for enough time to understand the patient's story. You don't want to be in a hurry. This is the heart of your nursing practice. Don't develop assumptions or have questions left unanswered, as this can lead to erroneous conclusions that could affect the patient's care. Do not interject your point of view or opinion, beliefs, or prejudices. Open, honest, and respectful dialogue with the patient and family is a standard of practice for the RN, who needs to be able to provide for the safety and security of the patient while respecting the right to privacy of the patient. This is extremely important. Next is the termination phase. This is the final phase when the nurse-patient relationship is completed. You need to make sure that there is a sufficient time to review goals and outcomes and patient teaching. And patients need that continued support because they may feel that a safety net is being lost. Either they're going to be discharged to home, discharged to another facility, or maybe their RN is now going to be off for the next few days. So again, it's a working phase. The working phase again is the longest phase, where the termination phase is not as long. Completion, again, may be a result of discharge or transfer, or and again, the patient may feel anxious during this phase because things are going to change, either going home or to another facility, and that may make them nervous as they've had the safety net of 24-hour care. So quite honestly, discharging sometimes can be actually a pretty scary process for the patient. We want to be cognizant of that so we can be supportive of the patient and their family. Next is a question. A nurse is in the working phase with the patient and is using therapeutic communication techniques. Which response by the nurse will facilitate interactions? 1, it must be hard for me to tell me how you are feeling. 2, that was wrong for you to do. 3, why did you do that? 4, it will get better tomorrow. Obviously, the answer is 1, it must be hard for you to tell me how you are feeling. Next, we're going to touch on health literacy and cultural competence. Health literacy is an individual's cognitive, social, motivational, and ability to gain access to, understand, and use information to promote and maintain health. This can be affected by education, culture, society, and the health system itself. Patients may have low health literacy skills, which include problems reading, problems with comprehending, errors, confusion. So good strategies that you would want to use are speaking slowly, be specific and concrete rather than general, avoid medical jargon or jargon anyway, and medical terminology. You want to reinforce information. You want to use the teach back technique and use easy to use and easy to read visual materials. Again, clear communication and visual aids can help patients understand how to access and use the health information, which is a good thing to do. The World Health Organization defines health literacy as, in quotes, the cognitive and social skills which determine the motivational and ability of individuals to gain access to, understand, and use information in ways which promote and maintain good health, and into parentheses. And there's a good website, which is where this came. Well, actually, this is another website, but the Health Resources and Services Administration, which is HRSA. And Joint Commission has also done a white paper, which actually recommends 35 different strategies to address health literacy. And it is What Did the Doctor Say? Improving Health Literacy to Protect Patient Safety, if you want to take a look at that. Next is culture, and it's really important that we understand people's culture. It's not that we know everything about their culture, but we do need to know what that culture, what their beliefs and values are, and learn patterns of behavior that help guide their thinking, actions, and decision making, as well as what helps guides their healthcare decisions. And some cultures do not like to have eye contact, but that may be, perfectly, aligned with their culture. So you need to be careful that you understand so that you don't misinterpret some of these verbal and or nonverbal cues. Cultural competence is the ability to provide care to diverse cultures competently. You first must have a self-awareness of potential conflicting feelings that you may have yourself. You may need to have interpreters. And again, nonverbal messages may mean different meanings in different cultures, so be careful. So again, among cultures, there are levels of health care literacy, which are affected, again, by education, culture, and society. Patients with low health literacy skills have the most trouble navigating the system because of the complicated rules, the medical jargon, and the lack of patient teaching. Clear communication and visual aids can help patients understand how to access and use health information in a better way. RNs in a nationwide study in 2003, in a nationwide study in 2003, 40 to 50% of people had literacy skills at or below the basic levels due to having a language barrier, which is pretty big. The care you provide as an RN to those of different cultures may be affected by your lack of knowledge, prejudice, bias, and stereotyping. People of different cultures may have different views and meanings to their language that may differ greatly from English. You may need to use an interpreter so that mistakes are not made and misunderstandings don't take place. And you want the best outcomes for your patient. So obviously you want to make sure the patient's understanding, of course, what's going on. So extremely important as well. And another health literacy group, which would be older adults, they may need special accommodation or changes, or they may need special accommodations because they may have changes in hearing and vision, physical challenges, psychological factors such as depression, poor self-concept, mood, attitude, and loss of control. Some strategies that we can use as nurses is adjust pace of instructions and provide extra time, minimize the distractions and repeat information, avoid use of abstract terms and negative messages, provide adequate light, avoid using blue, green, or violet ink, that's harder to see, use a lower pitch voice, eliminate background noise as much as what you can, provide a paper and pencil in case you'd want to write or have them write, and have the patient restate their message. So older adults, when we communicate with older patients, may present a challenge, of course, because of the hearing and vision changes. So the nurse needs to consider how illness reduces as well their cognitive function and consequently adjust the clarity of the communication. By 2030, 19% of the population approximately will be 65 years of age and older. This creates new challenges for us as nurses, and so it's important for us to communicate well so the older adult has a good understanding and is a professional, ethical, and legal responsibility of us as nurses. Normal changes in cognition from aging are distractibility and reduced ability to process information, according to the U.S. Department of Health and Human Services. Many medications can affect cognition as well. It's important to have individualized and purposeful care to meet the elderly needs. And again, you want to try to eliminate background noise as much as what you can to promote their understanding. So it's important for us to recognize these generational differences so that we can work together more collaboratively if we can have each other's understanding between the different generations. That's important. So you want to be assertive with your communication. Start with I. Describe, explain, state, and state the consequences. And be direct and honest. You don't want to infringe on other people's rights. Aggressive communication is more hostile and infringes on others' rights and starts with you and is blaming. Passive-aggressive communication is also not a good way to be, but you're aggressive in a passive way that helps manipulate the situation. So obviously you want to try to avoid communicating in these manners. We will be practicing the S-bar in our class, as well as you'll be able to use that in your clinicals for the Med-Surg Clinical 255 as well. So next is delegation. You already are probably practicing some delegation at where you are working, and you'll have even more delegation tasks when you become an RN. But so delegation is you're transferring authority to a competent individual to complete certain nursing tasks. So this individual must be qualified and must have the demonstrated competent ability to carry out the tasks that you're assigning them to do. The task can be delegated if it is within the scope of practice of the person to whom it is assigned. RNs cannot delegate these things such as assessment, planning, evaluation, and nursing judgment. RNs retain accountability even if they delegate. So even if they still delegate, they still are accountable for that patient and the care. And the 5 rights that you need to remember with delegation is the right task, under the right circumstances, for the right person. You need to have the right direction and communication, the right supervision and evaluation, and newly added is also the right documentation. So the RN must delegate care to competent, qualified staff members who are able to perform the tasks within their scope of practice. The RN must be assertive and clear while being fair but firm. The care manager is the RN and may need to delegate many aspects of the patient care to a variety of different individuals. The delegatee is given the authority to complete a task that is outside the usual activities of the role of the delegatee, and his people must be qualified and has demonstrated competency to carry out the needed task. Also, when you delegate, again, you want to communicate clearly and concisely while also considering cultural or ethical barriers. Again, you want to be sensitive, but you do want to use assertive communication, being fair but firm. And the more you're able to communicate your expectations effectively, then the more so that your coworkers will come to trust you and rely on you for clear direction. And delegation is an RN that's a key role of the RN, and of course requires critical thinking. And again, you just want to make sure that you're delegating to somebody that is competent in that task, whatever that might be. Also, you want to think critically about the needs of each patient, or whether or not say an LPN or a healthcare tech or aide can perform those tasks competently and safely. And whether or not you will delegate will depend on your assessment of the patient and also your professional judgment, whether you feel comfortable in delegating something. And collaborative communication, one of those is the nurse-physician relationship. It's effective collaboration that creates effective teams and improves the work environment. Problems identified by nurses can be, this communication can be inappropriate, disruptive, or abusive. It may be dismissive with attitudes and belittling or intimidating behavior by physicians, which of course is not good and doesn't foster good patient care. The Joint Commission has called for zero tolerance of abusive physicians, and it was found that failure to communicate among healthcare professionals, and get this, caused 70% of 2,455 reported sentinel events. So 70% of reported sentinel events was due to failure to communicate well. That's incredible. So one of the most problematic collaborative relationships is the nurse-physician relationship, and of course this can greatly affect the patient care. Differences in approaches to healthcare can cause communication breakdown. Nurses need to be empowered and be confident in their communications by providing accurate clinical information, staying abreast of the most current advances in healthcare, and joining committees and professional organizations so that you have a say-so and be abreast of the changes that may be taking place. Next, how to improve patient and nurse relationships. Again, nurses need to feel empowered, particularly if they need to feel empowered and secure in their clinical knowledge and expertise so that they can communicate effectively with the care provider. Improve communication, you need to first take responsibility for your relationship with the care providers. You need to have a calm and supporting demeanor, particularly when it's stressful, and you need to act in a mature, professional manner. Mutual respect and emotional maturity is foundational for effective collaboration, and collaboration is influenced by self-confidence. Repeating back orders and clarifying doctor's orders, this decreases the chances of compromised patient safety and enhances good communication and good care. You need clear and concise messages. You want to be involved with collaborative problem solving and understanding discipline-specific roles. So you want to understand each other's roles. So another question is, a nurse communicates using the SBAR communication tool with the physician. Which section is the A? Is it abnormal data, active listening, assessment, or assertive? And of course, it's answer 3, which is assessment. Next is something called team steps. It's team strategies and tools to enhance performance and patient safety, training caregivers to adapt to rapidly changing conditions, and the 4 major areas of topics are leadership, situation monitoring, mutual support, improve patient outcomes, and it also improves crisis communication and coordinated action. And this is really an evidence-based toolkit that was developed by the Health Research and Educational Trust, composed of materials and educational programs intended to promote teamwork among healthcare professionals. Another form of communication which is extremely important is documentation and documenting in the chart. It's a legal record. It's used to measure outcomes and determine cost. It may serve to defend care if litigation occurs. It establishes that standards of practice, policies, and procedures were followed and that standards of care were met. And it must be an accurate accounting of the patient's response to the illness and treatment. And the old adage stands true: if it's not charted, then it wasn't completed or done. Some forms of documenting that the RNs use are transmitting instructions, writing plans of care, recording interventions and outcomes, and writing nursing histories and nursing notes. You want to communicate assessment information, record and explain incidences, and pass on information. Write email, letters, and interdepartmental and interinstitutional forms. And again, remembering that all forms of communication must be complete, succinct, relevant, accurate, and of course, factual. So some common errors in charting or documenting are using a medical diagnosis rather than acceptable nursing language to communicate a patient condition, using broad terms instead of specific signs and symptoms, charting your own opinions, thoughts, and feelings. Of course, you don't want to do that. Neglecting to record the patient's response to the intervention, or using vague or ambiguous terms such as worse and better. So those are things you want to avoid using. So important to remember these things. Use objective measures when possible. Use proper grammar and spelling and write legibly. Documentation must be factual, to the point, descriptive, relevant, accurate, clear, and precise. Ethical and legal integrity of clinical documentation is a factor the RN must consider when charting electronically or through email, and patient confidentiality should always be the highest priority. Avoid ambiguous language, use precise verbiage, and when possible, use the patient's exact words and quotation marks. And again, remember that documentation should be factual, unemotional, and certainly objective. And documentation is communication with an electronic and other verbal communication. You need to state a purpose or need, problem or question of an issue, information, data, observations or experiences, conclusions or implications, perspective and frame of reference from which the reporting is being made with your electronic and other written communication. Documentation and correspondence to officials regarding incidents of unsafe practice must also be accurate, truthful, and without opinion. Chart audits require documentation, and RN is responsible for always maintaining ethical and legal integrity with all forms of communication, not just one or the other. Sound communication skills are the professional standard of practice for the RN and is extremely important in providing care. This now concludes the lecture on communication.